Now, President Trump he's got phone calls today with the CEO of Anthem. He's talking with the Health and Human Secretary, that would be Tom Price. He's talking with Paul Ryan, and he's talking with the House Majority Leader, Kevin McCarthy. What are they talking about? The health care bill, of course, and negotiations to get a replacement going for Obamacare. House Majority Whip, Congressman Steve Scalise, joins us now. From what I'm hearing, Congressman, is that because the CBO really trashed the Ryan plan, the president now has to negotiate and give some concessions to the Freedom Caucus, that the Freedom Caucus is now the one that's going to dictate the new plan. What say you?
Well, we've been meeting with all of the different caucuses within our conference for weeks now. In fact, if you look at the bill that we got out of committee last week, I was on the Energy and Commerce Committee, 27.5 hours. We debated that bill, took amendments, and every Freedom Caucus member on that committee voted for the bill to move it forward. We're very close on the differences where some people might have a different way they want to do things, but the CBO score actually confirms the big items in our bill. It lowers costs, it lowers the deficit, and it cuts taxes.
Right, hold on a second. One of the sticking points for the Freedom Caucus is the tax credits that replace subsidies. They don't like tax credits. Are you near to a point where you abandon the tax credit idea?
Well, you know, there were changes made to the tax credit back about 2 weeks ago to address some of their concerns. But if you look, conservatives for years have had the tax credits in different bills that they've had, from Jim DeMint to Tom Price before he was HHS Secretary, to Rand Paul. He's got refundable tax credits in his bill. At the end of the day, what we want to do is first give individuals freedom in health care so they can choose their own plan. That's front and center in our bill. We do a number of other things, but Medicaid reform is a big part of our bill too, but helping low-income families to be able to buy the plan of their choice if they can't get it through their company, through their employer. That's really the heart of the tax credit, and helps people be able to go buy the plan they want.
I'm going to ask you the same question I've asked a lot of folks who are involved in the health care debate, and it's this. If a poor person gets a catastrophic illness, cancer, for example, who pays? Under the system which you're proposing, who pays?
Well, if they've got a health care plan, then obviously their health care plan pays for their coverage. We're also setting up the ability for states to do high-risk pools for people with pre-existing conditions as well. That's something that will dramatically help lower costs. So our big focus was giving families the freedom to choose their own plan, lowering costs, which is the opposite of Obamacare, where you have increasing costs. Again, lowering the deficit, being able to make sure that people can buy whatever they want. Those are all parts of our bill, but there's a lot more that's going to be done in stages 2 and 3, where Secretary of HHS Price has broad authority to do even more things that will lower costs that CBO can't factor in. But when you look at the CBO report, it actually helps bolster our argument, because it shows we're going to lower costs. But even when they say 14 million people will lose coverage, those aren't people losing coverage. Right. Those are people that are choosing not to be on Obamacare. Yep. That's not lost coverage. That's freedom in health care.
We did take issue with that number. 14 million will lose insurance by 2018. No, 14 million people will not choose to get or be forced to get insurance. I think that's very important. Steve, I know you're a busy guy. I know you're going to get right back to the negotiating table. We wish you the best of luck. Thanks for reporting in to us this morning, Steve.
Always great to be with you, Stuart. Thanks.
Yes, sir. Thanks.